Officially would like to welcome everyone to this webinar that the Center for Rural Policy and Development is hosting with the COVID Collaborative. This is the second webinar that we've hosted on this topic of COVID-19 and its effects in rural Minnesota. The first one we had was in December. If you're interested in that, you can go and look at our YouTube page or our website at ruralmn.org, and you'll be able to see that webinar, which was very engaging, and at a time when Omicron was just starting to surge. So now we're obviously at a different point in time, and it'll be very interesting to talk with our doctor today, and also to hear from our panelists as well. My name is Julie Tesh, and I am President and CEO of the Center for Rural Policy and Development. We are a remote office. I live near Waseca, Minnesota, and we have staff in New London, Mankato, and then also St. Paul. But our organization, what we do is we focus our research on rural Minnesota policy issues. And obviously, healthcare is a huge issue all over Minnesota, but especially rural Minnesota. And so that's what we do. We're happy that COVID Collaborative reached out to us and that we can partner with them. Highly encourage you to go on their website and take a look at their information. A few more housekeeping things. Again, make sure to use the chat. We'll be fielding questions in there. Like I said, we have somebody doing that. And I think that's it. This is being recorded and will be posted next week on our YouTube page, Center for Rural Policy and Development, and also on our website. So with that, I am going to turn it over to our wonderful moderator, Christina Palladino.
Julie, thank you so much. Thank you so much for agreeing to help host this event with us and the COVID Collaborative again. Obviously, this is a very important topic. It has dominated our lives for the last 2+ years. So I'm Christina Palladino. I'm a senior principal of public relations and communications at Park Street Public. We have been working with the COVID Collaborative for the last few months. They're a national organization that is made up of bipartisan political leaders, influential people, high-profile people that are all trying to do their part, increasing vaccination rates for COVID-19, especially in rural America. And Minnesota was targeted as one of those states where we need to keep talking about this and educating people about this. This is far from over. And so I'm really happy to be moderating yet another webinar again for the next hour and 15 minutes or so. We're going to be taking your questions as we get going with this panel discussion. So please feel free to drop those questions in the chat and in the Q&A. I'll be answering or asking them and hopefully getting some great answers as we go. I want to bring in Dr. John O'Horo. He is our keynote speaker for this webinar. I am so excited to be talking with him. He has been doing the media rounds for the last 2 years or so, has a ton of great expertise and knowledge, but is also really able to break down what we need to know, where we're at in the pandemic right now, and how to, prepare ourselves, educate ourselves, and safeguard ourselves as we move forward. So I want to bring in Dr. John O'Horo from the Mayo Clinic. He's an infectious disease specialist. Of course, he wears many hats and has been very busy over the last 2 years. He also is the Joint Appointment Division of Pulmonary and Critical Care Medicine. Dr. O'Horo, thank you so much for being here. I'm going to turn it over to you for a brief presentation.
Thank you. I'm going to talk a little bit today about a topic that's come up a lot recently, which is what does it mean as we approach this endemic phase of disease? We passed some very significant milestones in terms of the number of deaths in the US and the world this past week. But even as those numbers are going up and hitting the 1 million and 6 million threshold, we're getting to a point where the daily cases are coming down rapidly. And a significant part of the country is seeing a lower and lower rate of disease transmission. What this ultimately is going to mean is that we're going to get to a state where there is a certain stable background level of COVID-19 in the community. It's something that we might see go up during the winter months. We've seen some seasonality with it so far, and we see that with virtually every respiratory virus, so it wouldn't be unreasonable to expect that. But there will be a defined threshold of what's sort of a normal number of cases to see in a given community of a given size at a given time of year. That's really what an endemic means. It's not the end of COVID-19, but rather it moving into a background where it's at a manageable level where we can use some of what we've learned over the past 2 years to cope with it, as opposed to reaching levels where it challenges our hospitals, our clinics, and our schools and communities in general. Part of what it means to stay in, will need for us to stay in that endemic range is for us to be in a spot where we're keeping the disease severity in check. And that's where vaccination is going to remain a very important tool. Part of what got us to this point is the vaccines, lessening the severity to the point that we're seeing fewer hospitalizations now than we have with others. While Omicron has been accurately described as being milder than previous strains, that's not the same as being mild. And a big part of what's kept that peak from overwhelming the hospitals, despite those high numbers we had at as bad as it could have been, is the high number of vaccines we've had. But there are still significant unvaccinated pockets, and that's something that gives us a continuing risk as we go into this endemic phase of disease. In the coming months, we'll probably see ourselves reach this endemic threshold, which is going to be defined by epidemiology more than anything else. And it's not going to be entirely clear when we've reached the endemic threshold until we've actually been there for some time and the numbers have stabilized. But the main concern we have is that this isn't a one-way door. As we enter this, the potential remains for this to surge back if enough people become susceptible, if there's a new variant that's more severe, or if there are other unforeseen circumstances that accelerate spread. So as we go into the endemic phase, it's worth starting to think about other endemic illnesses and how we live with that. The one we're probably the most familiar with is the flu. It has a well-defined seasonal pattern. We know it gets worse in the winter, it gets better in the summer. We know that what we can do to make sure that we can live with it and that it doesn't overwhelm us is get our flu shot, stay home when we're sick, and do some basic respiratory etiquette. And those same principles are going to hold true here. I have very little doubt that there will be some revaccination at some point. Whether it's this upcoming fall or not is something that's still an open question, but that's going to be what's needed to keep this from surging back again next year, when presumably some of our natural and vaccine related immunity is waning and we're at a point where we're susceptible again. So maintaining the vaccination that this group has been doing is crucial to ensuring that we go forward and don't see another pandemic, and that we see fewer of infectious disease specialists like myself doing things like this, because it moves more into the background. So with that sort of brief introduction, I've always found that questions are much more much more valuable than anything I can say in a set statement. I'll hand back over to Christina.
Thank you so much, Dr. O'Hara. We really appreciate it. You know, while I have you on here, a lot of people feel like, you know, like you said, we're kind of hopefully inching closer to the endemic phase. You know, what's the point of reaching out to people about vaccines? People have already made their minds, they're dug in the sand about it. If they're decided they're not going to get it, they're not going to get it. As an infectious disease expert, do you still see openings and opportunities to talk to people about vaccines? And if so, how do we approach those conversations?
Yeah, so when we're approaching vaccine hesitancy, it's very important to try to figure out what the exact reason for hesitancy is, because this isn't a one-size-fits-all issue. There are some who will not take vaccines no matter what. They've made up their minds, but that's a very small group of people, in my experience, who are that dead set on that. The larger group is those who either have some misinformation or feel there's insufficient information out there. And the best way to challenge that is with accurate information. And as we go forward with more information, those who question the safety profile of the vaccine in particular, saying that there hasn't been enough experience with it. Well, we have a lot more experience now than we did 6 months ago. And in another 6 months, we'll have even more. So keeping in mind that there are those who have concerns that have to do with uncertainty, and being able to shade in that there's less uncertainty every day.
Yeah, absolutely. And there's been some talk about creating vaccines that, you know, specifically target certain variants or upcoming variants. We know that, you know, in a somewhat similar way, the flu vaccine kind of does that. Do you foresee that happening come next fall or winter? I mean, that would be exciting, I think, for a lot of people to hear that there could be that very focused, you know, technology being made right now.
Yeah, there has been some work made on making variant specific as well as more general vaccines for COVID-19 with every major variant that's come up. So far, those haven't necessarily been needed since the existing vaccines have worked fairly well against Delta, and Omicron came and went so quickly that it's hard to say what would be needed there. But like you said, for flu, we see a different sequence every year where we have a few different variants that are targeted, and it's going to likely be the same for the COVID vaccinations going forward. I don't know right now if it'll be in every year and every other year what that cadence is going to look like. So I say the fall just because I'm extrapolating based off of the flu, which is probably the closest thing that we have to this in our experience. But whenever that comes around, it will be targeted that way, I'm sure.
I think sometimes we get lost in this conversation. You had alluded to it earlier. There's a lot of misinformation. But at the end of the day, these vaccines were made very quickly by really smart people who have tons of experience and background in, making vaccines. And they're pretty remarkably done well to prevent severe illness and death. And I think sometimes that gets lost in the messaging. Just from your perspective, I mean, they've been incredible with preventing a lot of severe illness and death. Can you just kind of talk about that a little bit more and kind of remind people that's really the goal with these vaccines?
Yeah, so these vaccines were initially meant to target reducing the severe complications of COVID-19, including death. And when original targets for vaccine efficacy were discussed, there were numbers in the 60s and 70s, getting these ones that were initially able to prevent any disease and the 90+% range, and then later would continue to do so for severe disease, was far, far higher than we ever would have expected that these could do. The rate at which these incredible vaccines came out, incredibly effective, and due to how closely scrutinized their rollout is, I'm comfortable saying incredibly safe vaccines, is nothing short of remarkable. What's been unfortunate with this is that although we've had a lot of good science to develop these vaccines quickly and new methods that have been used and will be used for future pandemics, we've seen that there's a lag in how we can communicate this to the general public and translate those scientific findings into meaningful benefits for vulnerable communities. And that's part of why I think that groups like this Rural Vaccine Coalition are so important.
That's great. And one last question I wanted to ask you before I get into the little slide presentation, and then of course bringing in this panel. Just what are your thoughts and what have you kind of learned about potential, vaccines working for some of those, long COVID patients and symptoms that we're still learning a lot about? This virus has only been, around for 2 years. Is there some promising data? I've read some things that suggest that.
Yeah, there is some interesting data on long COVID syndrome, but long COVID is one of the few things that I can say is newer than COVID-19, so it's less understood than that. And it seems that long COVID probably has a few different subtypes within that. There are those who seem to have some heart type issues, lung type issues, and more chronic fatigue type. And it's not entirely clear that long COVID is just one illness or if there are several different types within there, and the effects of vaccines and mitigating that are likely to be different across that. Nonetheless, given how beneficial vaccines have been in reducing cases and severe diseases, that seems to be very promising.
That's great. Well, Dr. O'Hara, thank you so much for joining us at the top of this webinar. We would love to have you stick around if you can for the panel discussion. We understand, though, you're very busy if you have to go, but I think there'll be some more questions from the audience for you. I'm going to go into a little presentation here. Let's see, where is that? Okay, can you all see my background? Hopefully so. Okay. So we're going to just hit a few slides here on kind of the latest data of where we're at here with COVID-19 in the state, or particularly rural Minnesota. Of course, this Sunday marked officially the 2-year anniversary of the first case diagnosed here in Minnesota. And of course, we've gone through the last 2 years, some very tragic with many deaths, some very frustrating moments, just twists and turns, with this pandemic and the state and how we react and how we make sure to, keep people safe. The researchers at the Center for Rural Policy and Development, again, they're one of our co-sponsors of this webinar. Their research team, which is fabulous, they dug through the most recent data of vaccines and some other interesting trends when it comes to COVID and just how it's impacted, particularly rural Minnesota. So as you see here, some of the recent data, cases that have hit rural population centers the hardest. You can see Candy-Ojai, Roseau, Nobles, Waseca, Mayo, and some of those counties surrounding them. They had the highest number of cases overall. The presence of large manufacturers, some of those meat packing plants that were deemed essential early on in the pandemic, they seem to be some of those places that may have had some really high case counts and clusters. We go to the next slide here, the death rates highest in the most rural counties. Although fatality rates started higher in urban areas, as we know, rural counties soon caught up and surpassed urban areas in the fourth quarter of 2020. Factors potentially contributing to those higher death rates in rural areas, most likely an older population, higher rates of comorbidity, vaccine hesitancy, of course, as we just addressed, and less access to ICU beds and just overall general health care. Third slide, vaccination rates, which of course is the goal of this webinar. And again, this is taking into account people over the age of 5 with at least 1 vaccine dose as recently as February 6. You can see there entirely urban counties, vaccine rates about 79%. An urban town rural mix about 64%, a town rural mix about 57%, and then entirely rural counties 61%. Counties just north of the Twin Cities metro have the lowest vaccination rates. Only 50% of the population has at least 1 shot. Counties in southeast and northeast Minnesota have some of the highest vaccination rates in greater Minnesota. And then just breaking down vaccination rates by ethnic group, again, with those having 1 dose as recently as February 6. You can see 86% of people who identify as Asian and Pacific Islanders, 71% of people who identify as white, 71% people who identify as Hispanic, 67% people who identify as African American or Black, 60% of people who identify as Native American, and then 39% vaccination rates in people who identify themselves as multiracial. So again, we can send all that information out as we kind of do a recap of this webinar. Some of those slides have some really great data points that you can reference from this webinar. So at this point, I would love to bring in our panel. We have a great panel discussion. We're going to have plenty of time to really get into some details about different industries that have been impacted. I first want to bring in Brenda Geldert. She's the Executive Director of Options in Big Lake, which is in Sherburne County. It's a day service center for adults with developmental disabilities. I want to bring in AJ Humes, Certified Registered Nurse Anesthetist at Lifecare Medical Center in Roseau. Jenna Kuduk, RN Health Services Director at Ne-la-Shing Clinic at the Millex Reservation Band. And lastly, Nicole Anderson, Commissioner of Health and Human Services, also at the Millex Reservation Band. Thank you so much for all of you joining us. And Dr. John O'Hora will also be here with us as well. This is a really great, diverse panel. I don't think we've really dug into some of these different cultural groups as well as different, industry and sectors. So I really think we're going to have a great discussion. I first wanted to do a round robin of the panel, and in a minute or less, please tell us why you felt it was important to participate in this discussion. Of course, increasing vaccination rates in greater Minnesota. Nicole, I'd like to start with you.
Sure. Thank you, Christina. Again, Nicole Anderson, Commissioner of Health and Human Services for the Millex Band of Ojibwe. I believe it's always important to educate. Oftentimes people do not understand some of the specifics with rural areas, especially reservations. And so given this opportunity to kind of discuss what we've gone through here at the Millex Band of Ojibwe, how that affects rural communities and some of those differences, I think is really important.
Excellent. Jenna. Oh, you're still muted.
Okay, there we go. Jenna Kuduk here I'm the Health Services Director with the Millex Band of Ojibwe. I just feel it's really important to be here. We've been battling through COVID for about 2 years now, and if it's anything we can do together as a community and help other communities kind of evolve into getting these vaccines out there and getting the knowledge out there so we can really start to put things kind of at rest for where they are. So glad we could be here.
Me too. Brenda.
Hi, Brenda Geldert with Options, and thank you for having me as well. For our Options reason and drive to encourage being vaccinated has been somewhat twofold for us, both as a business and as a provider for day services with people with developmental disabilities. We serve many people with comorbidities, and certainly COVID was and continues to be a serious concern of ours. Getting vaccinated was critical for us to feel safe for people to come back. It was important for people to feel safe returning to program. And as a business end of it, we are a fee for service. We were closed for several months under direction of the Department of Human Services. We had significant financial losses. So we were committed to doing anything we could to preserve our business. And we definitely continue to view the being vaccinated as a way to safely return to protect our company and to return to some normalcy.
Absolutely. And AJ.
Thank you for inviting me. My name is AJ Humans. I'm a certified registered nurse anesthetist up here at Lifecare in Roseau, Minnesota, which from your presentation earlier, you can tell has some blue in the wrong areas and some light blue in the right areas. So we are working on increasing our vaccination rate as a county, and anything we can do to help that is important. With an overall vaccination rate of about 52.5%, we know we're struggling to reach people, and one more person is one less person that I may see in an inpatient setting. We're tired. I can say that firsthand. We are tired from an inpatient setting, and I think one more person is one less person is important.
That's really great. And AJ, I want to go back to you because you're part of a 2-person team up in your area, which we highlighted in the presentation, as well as yourself, has a very undervaxxed community. Just talk about what it's been like, especially getting out of this latest surge, which seemed like everybody around us got COVID. What's that like being part of a 2-person team?
So our biggest thing is, before COVID, we always had the availability to transfer patients to, whether it be Grand Forks in North Dakota, Fargo, North Dakota, or even down to Minneapolis. And it really wasn't difficult. When this latest surge hit, we went probably 6 weeks where we would wait 3 or 4 days before we could transfer people that are needing ICU care. And as a facility that doesn't provide ICU, it doesn't have an ICU, we really have to act as a resource, and it leads to long hours for us, for our physician providers, and we really have to really work as a collaborative team. Managing an event, we don't have a respiratory therapist on 24 hours a day as a critical access hospital. We have 1.5 FTEs total for respiratory therapy. We don't have providers that are comfortable with ICU sedation, and so for us, it's really my partner and I really acting as a resource and placing getting privileges and for central lines, managing vents, as an intensivist would in a larger setting, because we just don't have the ability to essentially fly these patients away. And, for us looking in the future, we are really thinking now, what do we want to know 6 months from today? Like, what would we wish we had known 6 months ago for 6 months from now? Because for us, we're trying to do everything we can to, whether it be increased education, in terms of our inpatient staff. Our hospital is excellent at providing resources. We just have to identify what resources are very valuable to us, moving forward, that'll allow us to take care of patients even better.
Absolutely. Nicole, as the Commissioner of Health and Human Services at the Millex Band, we know the Native American community has been hit really hard by COVID. Talk about your concerns with the vaccination rates that you see not only in your community, but within Indigenous populations across the state.
Well, speaking for our community here, very, very early on, we ensured that we had access to community members and really wanted to provide that education and access to our most vulnerable parts of the population. And so I think the health services team here did a really, really good job of getting the vaccinations out there, ensuring we were hitting each district and providing education. I think it's always important to provide as much education as possible and access to the vaccinations, especially for those who are in populations such as Native American communities who have a higher risk. We all know that Native American communities have higher risk of diabetes and a whole array of things that were really impacted during the pandemic. And so from my perspective, we continue to get that information out into the community by multiple avenues, whether that be videos that we've done here in Health and Human Services, community meetings. At one point in time, we were going door to door providing information. And so really capitalizing on our staff here and getting that information out to the community members and really ensuring that they felt safe. And Jenna actually was the voice of our COVID line for the last 2 years. Very early on, we implemented that, and that seemed to really put people at ease and ensure that whether they had questions at 9 o'clock at night, she would answer that phone and she would talk to that elder or whoever that was and reassure them. And so those are kind of some of the things that we've done here in Millex. And I think we move forward to continue to provide that education and access to our community members is going to be really important.
Nicole, you could do what I'm doing. That's a perfect segue into Jenna. You obviously are very hands-on. People trust you, they know you. We know that's important when we're talking to people about, vaccination. How do you see, what your work was like the last 2 years, and then continuing to implement that and meeting people where they are? And like AJ said, even if we can get one more person to get vaccinated, that's one less person we're going to see, needing a ventilator. Just talk about what that hands-on approach has been like, Jenna.
Sure. So I think it's always going to be a work in progress. I mean, there's always more and more to be done and more to get out into the communities, especially with information changing. As CDC has changed some guidelines or opened things up for the earlier ages of children. It's just a matter of getting those pieces out there and meeting the community where they're at. Early on, we knew that there would be questions after hours. So we opened up a COVID phone line. And we took calls at any point throughout the day. Part of, I think, our best that kind of supported our vaccines is we offered education right out of the gate. And then throughout vaccines, we've had providers available for curbside questions throughout the process. If they ever had any questions or needed clarity on what was good for them vaccine-wise, which one they would choose. So that was really beneficial. And we got really great feedback from the community on having a provider available. And then afterwards, the vaccine clinics, the phone line is open. So anyone can call if they have questions and those types of things. We would take our vaccine clinics on the road, and we've went out to all of our smaller communities and offered vaccines just to make sure that everybody had an opportunity. We've also realized that some people will like to come in on their own and get a vaccine. And so we've honored that and had just a private appointment. But throughout our community, it has been very well received, opening it up for the whole family to come through together. So we've kind of really molded our practice to what the communities wanted and needed. And if that's helped us vaccinate more people, then we've done our job.
Absolutely.
Meeting people's needs.
Yeah, for sure. What do you sense is the interest level or the engagement level at this point in the pandemic, in your community on vaccines?
You know, every vaccine clinic we host, there's a few more new people coming through the door. So I don't think that the interest is stopping. I think that there's still people coming through, but I think they're coming in and through at their own pace, and that's okay. The more and more education we get out there, you know, maybe that's helping people decide to get the vaccine.
And Dr. O'Hara, I imagine that's good news for you to hear, that even if it's just a couple people, it's still people, you know, finally making the decision to get the vaccination.
Yep, every individual who is being convinced to get vaccinated is a win, and especially if that makes them more likely to get vaccinated again in the future as we look towards seasonal revaccination needs.
Absolutely. Let's shift the conversation to the workforce and, you know, how that's taken such a huge hit and why, you know, vaccination is crucial. Brenda, I love how you started off your introduction. Can you just talk more about, you know, just from a business woman's perspective, as well as, you know, your industry, which we know has often been overlooked sometimes in this conversation?
Yeah, absolutely. You know, what we need staff to provide those very important supports for people to work and be part of their greater community. Currently our industry has over 20,000 open positions throughout the state of Minnesota. So obviously early on are critical for us to protect and support our workforce in any manner. You know, including, of course, even after the federal mandate to provide sick time, we continued that for an additional 3 months. At the end, we continued with 40 hours through the end of January. This industry tends to have a lot of single parent or single person households. So we wanted to ensure that our staff were not calling in symptomatic, or we're not coming in symptomatic and avoiding missing any kind of pay. So we wanted to really make sure it was easy for our staff to be able to do that and not, of course, create quarantine issues. And that was for our unvaccinated staff, that did create a hardship earlier on. The quarantine periods for unvaccinated staff was frustrating. It led to us being short. We had to cancel services for clients for up to 10 days during that period, earlier periods. We spent countless hours contact tracing and in those efforts. And it was a really incredible burden on our residential providers, who are very much struggling for staffing as well, and having to have services canceled for extended periods. So we're very fortunate. Our average vaccination at Options is 86%. We beat down the doors of our county when vaccination became available, and kept calling, and finally were able to get in, and, you know, in early February, finally seen as kind of that essential first line worker. And I was disappointed that I didn't have more staff turning out for it. I think I was shocked, and maybe because when you're in that line of fire for your business for 2 years, or for a year at the time, to have that people just say, no, I'm gonna pass, I think was really unsettling for us. But we've continued to try to encourage it. You know, we're paying for time off to go get it. We're paying for 2 days of sick time after it for that, as well as the booster. We're paying mileage. We just are trying to do everything we can, even as a nonprofit, and even at a you know, additional expense to our company, to do what we can to you know, ask staff to just be kind of bigger thinkers about this, again, because of the population we serve and some of those more fragile people.
Absolutely. And you even said at one point, you know, just some of the people that you serve, you know, obviously talking to them about why it's important to be vaccinated, you know, obviously bringing in some of their family members to educate. That there's a lot of work and relationships that go into that. That's that trust, and having maybe more than one conversation. Just kind of talk about, you know, what that was like. And I'm sure those conversations are still ongoing.
Well, like everywhere, it's very politicized. And in Sherburne County, I think the vaccination rate for 2 vaccinations is 51%. We actually were asked by the vaccination clinic. I think it was in April of when the vaccination came out. We were absolutely thrilled to be able to host that. We took all of our own manpower. We physically called every individual we serve, which is 242, and called their guardians, trying to get people in to be vaccinated, having a lot of good conversations about that. We were very disappointed it was canceled due to the Johnson & Johnson reprieve. But we actually struggled to fill, I believe it was 250 spots. We were calling every business in our community saying, hey, we're having this clinic, please come, please come. So certainly our efforts was just to really reach out to our community as well, especially those frontline workers, and do what we could. But we have clients that, you know, their guardians, if they have a legal guardian, still won't allow them to be vaccinated. But we saw, especially, we had the most COVID we'd had in 2 years in January and February of this year, like everyone else. And I think a lot of staff were frustrated, like, why are we vaccinated? It didn't matter, but it did matter because no one was hospitalized. Not a person was hospitalized during that period. And we kept our efforts up, and we definitely see it as more of a multi, you know, kind of prong approach with face mask wearing. We have ion generators. We have all of the, you know, UV wands and the hand sanitizers and distancing. We did everything even more than we were supposed to by regulations with the Department of Human Services, and it paid off. It definitely paid off.
Dr. O'Hara, what's your reaction to hearing what Brenda just said, that, you know, basically COVID spread like wildfire in January and February in their facilities, but hardly any hospitalizations, no deaths. Again, it's going back to that messaging that the vaccines, they worked. That's the whole point of them.
Yeah, the vaccines really did a wonderful job of keeping those out of the hospital. I have as of yet to hear of a hospital that reports anything other than 80-ish% of those who they had who were hospitalized for COVID or having severe COVID were unvaccinated. And it really seemed to be a drastic impact. And even if you got hospitalized, you're less likely to be in the ICU, less likely to be ventilated. They do a wonderful job of that even during these periods of high spread.
AJ, up in your community, do you think that messaging is actually getting through, that these vaccines are, you know, obviously there's going to be a rare case here and there of somebody who's severely immunocompromised, but these vaccines are preventing people from getting very sick and dying. And that's, you know, something that I feel like sometimes doesn't always get through to people all the way. I imagine in your community where we know vaccine rates are really low, that must be frustration out there.
I think for me, the message I try to promote is exactly that. I don't post very much publicly, but I post Sanford Health's regular updates of the hospitalized population and how many are in the ICU, and they post vaccinated versus unvaccinated, because it's important to me as the provider I am to be a trusted, you know, source of information. And so I try to keep the information I do post to be very succinct. And I think many of our primary care providers are doing the same. I think we constantly are fighting, you know, I think somebody said the head in the sand mentality. And I think day by day, it's clawing those people back out of the, you know, the misinformation that they may have read early on, or, you know, I would say the poor mask compliance early on definitely led to, I mean, if we had a mask mandate in the state, I'm not sure you'd have known it up here at times. And so, you know, it's just about education and trustworthy education, and trying to just bring those people back when they're coming in for primary care visits, and one by one trying to get more and more vaccinated. I mean, there's a certain sect of the population we're never going to get vaccinated. I think we all agree on that. But if we can get a few here and a few there and seasonally, you know, get on top of it, I think it'll significantly help our population up here. We had major employers, whether it be, you know, some of the, we have 2, 3, 4 major employers up here, such as Polaris and Marvin Windows, that are in our county. And I think slowly, as outbreaks took place, I think we realized the need for vaccination in those facilities was even more important as well.
Yeah, and that goes back to what Brenda was saying. I mean, do you think, did you notice a difference as a healthcare provider in the area when they kind of, you know, spoke out or used their influence a little bit? It helped maybe in convincing some people?
I don't know if it's a hard thing up here because our labor market is so short as it is. And we don't want and we didn't want, I should say at the time, to have less labor than we already have. You know, we're bringing employees from out of the area as it is, and I think it's hard to take a public stand. They had very good protocols in place. They had very good health screening in place at the door. The hospital was working in conjunction with COVID testing as well. And so we tried to contain what we could. It's just when you have a small, you know, area and a lot of people, it was definitely a factor that I think led to our high rates of COVID within the state. And then you topple that with the fact that our school was in person most of the entire year, regardless of vaccination rate or hybrid for a very short time. I think it's just we tried to live our life as if it didn't exist for a long period of time.
Yeah. I want to go back to that, you know, misinformation, and, you know, it can be said misinformation can kill, especially if, you know, people are getting information from bad sources or it's not true. Nicole and or Jenna, I mean, can you talk about what that was like on the band of just maybe people not getting the right information and believing people that had no credentials, no medical background talking about vaccination, and how that impacted the low rates sometimes in your community?
Sure, I can speak to that a little bit. As far as misinformation goes, I would say initially we had a very strong interest in the vaccine, especially with our elderly population and people who have compromised immune systems. So I think from our perspective and what we've seen, we had a lot of interest initially, and throughout many of those beginning vaccine clinics. Jenna could speak to that a little bit more, but I think when people had questions, they tapped into the education we were providing. They called the COVID line, they asked questions. Our pharmacist did a video on exactly how the vaccine works. And we just provided information to the community over and over again. Were there some areas that there was maybe more interest in the vaccine than other areas? Sure. But during that time, we really made an effort to continue to provide education, to continue to provide avenues for people to get information that they sought. I think just like everywhere else across the state of Minnesota, there were articles that were maybe shared on social media that made people have additional questions. But from my perspective and the people that I spoke with, people asked those questions and then they made a decision. And oftentimes we, like Jenna said, we had a provider available to answer questions. What are you concerned about? Here are the facts. And we tried to stick with factual information.
Jenna, anything else you'd like to add?
Yeah, most of our vaccine clinics early on, we had all the doses spoken for with a waiting list. So if people didn't show, we had runner-up people in line waiting to get those vaccines. So right out of the gate, we had a really strong presence for people wanting to get the vaccines. And over time, and our leadership within the Millex band did a really good job of getting the staff's faces out there, kind of getting the community to know who's here and what we're offering. And so there was a trust that was built. And so I think the more and more we left our lines open and providers available and going door to door with information, lining up rides for people who want to come and get the vaccine but don't, they didn't have a ride available. Kind of working every day, learning new barriers, and as a team breaking them down for people to be able to get the vaccine.
Yeah, I wanted to ask about, children 5 to 11. That was just, authorized in November, right before the holidays. Did you have a strong response from parents who wanted to get their children vaccinated?
There were two groups again. There's the groups that got in line first, that wanted to get the vaccines right away. And then there's a group that's a little hesitant. And we're still continuing to educate and offer the schools even educating a little bit on their on vaccines available and what that looks like and how that's helpful. And so we're just going to continue to keep working on it. But right out of the gates, again, when it was opened up, we did have a large group that came and were in line for vaccines. So
yeah. And Dr. O'Hara, I want to ask you about that. I mean, we know that the vax rate for 5 to 11s, it hasn't been great. Obviously, the little ones still can't get vaccinated yet. Just your thoughts on children. We know Omicron obviously infected a lot, so there is some temporary immunity, but moving forward, if we have a tough time with adults sometimes, how do we kind of bridge, for kids getting vaccinated as well?
Yeah, kids have suffered in a few ways during this pandemic, both from social isolation, missing some of their routine health visits and other vaccines because of that, and from the lack of availability of a vaccine for themselves. Now that it is available for that age group, it's going to take some time and effort to catch up in that. And I understand parents being more concerned about that than they might be for themselves or for other adults. But the safety record of this remains spectacular. And we're still seeing reductions in the risk for children that make that a very important group to reach out to.
Absolutely. And another question for you, Dr. O'Hara, because I think this might seg nicely to the other group of panelists to talk about, what's coming down the pipeline with potential future variants. Obviously, we know you can't predict the future, but do you think, I kind of like to say we're in the honeymoon period right now where things seem as low as they've ever been. Do you think, Minnesota is in a stronger position now to handle future surges, or are we weaker because of this whole, pandemic fatigue and just kind of that vax hesitancy that still exists?
Yeah, the time of year with that seasonal variation, the increased rate of vaccination, and the wave of Omicron coming through and giving us a boost of natural immunity for many as well, all put us in a fairly strong place for the short term. Where I get more concerned about this is really about what's going to happen in the fall here, as we are going to see new variants. You don't need a crystal ball to know that, because that's what viruses do. Whether or not we're going to see ones that are drastically different like we saw with Omicron or Delta before that, or if they're going to be more like the shift between the wild type and the alpha beta, which was much less marked, is hard to say. But there will be variants, and it's going to be crucial that we reach out to make sure that our vaccine rates are high enough that once we have that combination of new variants and waning immunity, we can be in a stronger place going into the fall and winter.
So with hearing that, AJ, what kind of, as a healthcare worker, I mean, like you said, you've been just on go mode, for the last 2+ years. What do you think about when you hear there will be future variants and just the work that needs to still be done?
I think that's why we talk about where do we want to be in 6 months, retrospectively thinking about what we could have done better and what we can prepare for in the future, I think is the biggest thing. It's not if, it's when. And yes, we all hope that the next variant is, less and less and less invasive or, dangerous, but we don't know. We don't know, and we have to prepare for the worst until the worst doesn't come. I think for us, our biggest things are preparing and trying to get that, under 12 vaccination rate up. It's significantly lower in our county. I think our 5+ rate is like 55%. And I think that also translates to getting their parents vaccinated as well. I think parents are going to have to get themselves vaccinated first before they, they're going to be more hesitant with their children. And so I think that just comes back down to primary care visits, which we know during the pandemic were lacking. I mean, we know regular vaccination rates were lacking in our county during the pandemic phase. And so it's important as we catch both of those up through primary care visits and education and quality education and trusted providers providing that information. I think it's important that we continue to get our vaccination rate just a little bit higher and a little bit higher, because we may not be a very high populated area of the state, but when it comes very fast.
Brenda, how do you kind of manage as a business owner looking forward, knowing that there will be future variants, there will be future surges, and how do you manage the business, continuing to increase the education with vaccines, that it's concerning that to know that it's still going to be this bumpy ride?
No, we're a nonprofit at the mercy of the state legislature. We're used to dipping and doing what we need to do, obviously. We did provide vaccination videos and educational materials. We actually required that to be viewed. I don't know that we're going to change some of the younger staff's minds, frankly. Really a common thread with them seems to be surrounding their reproductive health. And I think that has been heard by many people. my hope is that at some point we can get this to, you know, where if it is an annual vaccination, that we do provide it like we do our influenza clinic, that we can bring someone in. A lot of times that seems to be helpful for people to have it right in front of them. They don't have to go somewhere. They don't have to do anything but show up to work and access that. So I think, you know, just for us, we'll continue to have our pandemic preparedness plan on tap and continue our other mitigation efforts.
Absolutely. Nicole and Jenna, just your thoughts, knowing that there is going to be a future variant, you know, seasonally, and just kind of how you prepare and continue that education to get vaccinated for that.
Sure. So, you know, very early on, the Millex band as a whole took a very proactive stance, I would say, to the pandemic. And so we put a lot of work in to be prepared for what could be. And as Jenna mentioned, it's been a work in progress, right? And we've learned stuff. Some stuff we got right out of the gate, and some stuff we had to pivot and kind of take a new direction. And so throughout that time, we've had a really fantastic group of people who work in HHS and for the band. And I think we're in a place now that, although I don't want to go through what we've gone through for the last 2 years, especially that first year, I believe we're ready for what comes next, as ready as we can be. We don't know what's going to happen. We didn't know how the last 2 years was going to roll out, but with strong teams and working together, we've made it this far, and I think we did a pretty good job. And we're at where we're at, and the numbers are going down, and we can all take a little bit of a breather and prepare for what may come next.
Jenna?
Yeah, I agree with Nicole, or Commissioner Anderson. We have just a wonderful team, and how everybody's come together, and kind of, you know, there was that calm again, and then the Omicron came through and everybody picked right back up where we left off and hit the ground running. And we were able to, you know, get education pieces out to the community again, continue to wear your mask, stay 6 feet apart, wash your hands well, carry that hand sanitizer, all those pieces. And, you know, I think that says a lot that we were just able, our big word around here is pivot. So yeah. Every time something comes down the line, our whole team's like, we're ready to pivot. So, and I think we're just going to have to keep up with that. So.
Absolutely. I did want to encourage people tuning in to definitely send your questions into the chat. I think this is a good time now. There's a couple of questions in here to bring up, and usually as one person asks, you know, more kind of prompt. This is from Martin Jennings. Dr. O'Hara, I don't know if you can answer this, but I just thought, you know, you're the Mayo Clinic expert here. He asked, what is known about unvaccinated demographics and locations? Obviously, I did a slide where we know some of where those locations are, but in terms of the demographics of unvaccinated, do you have kind of some information off the top of your head of what stands out to you and kind of where, like you had mentioned at the top, you know, there's those pockets, we know there's pockets that work needs to be done. Could you just kind of expand on that a little bit?
Yeah, so two of the big trends that stand out are that this younger people are, the lower the vaccination rates are. The over 65 cohort was one of the ones that had some of the best uptake, and I think it's because the risk was much more evident to that group. And whether or not that's part of the message that needs to be translated down to other groups is what risks exist as you get younger is something I'm not sure of. The other one is that the further you are from some of the major urban centers, the less likely you are overall. And that's something that where this kind of rural outreach remains crucial, since that's one of the most at-risk groups. We saw earlier in the pre-vaccine era, as was already said, that the first clusters were in some of these counties associated with some of the meat packing plants and other things, and those continue to be some of the areas where the vaccine rates are the most uneven across the board.
Absolutely. Another question from Barbara Chaffee, or Chafee, I hope I'm pronouncing that correctly. She asked, would you address the long-term effects of long COVID, I'm assuming, that many are experiencing? And we did touch that a little bit. And I think that goes well with what you just said, that a lot of younger people feel like they don't necessarily need to be vaccinated because they're young and they're healthy. But we do know that for whatever reason, some people are experiencing long COVID, and it's not pretty. Some of the symptoms that they're reporting. Just maybe could answer her question about just what we've learned about long COVID, and I don't know if there's a way to prevent it from happening to you. Obviously, vaccination probably is the answer on that one.
Yeah, so long COVID remains one of those things that is really a big unknown because it is so new and because there are so many variations, and we don't really know if it is one illness or many variations on the same illness or different after effects that different folks get. The effects of vaccines is somewhat promising in some studies, but it's still a little too early to say. And right now, really all we know about long COVID is that the best way to avoid it is to avoid getting COVID in the first place.
Absolutely. Another question here, how could local public health been more helpful? That was a tongue tire. Nicole, this might be something for you as the Commissioner of Health and Human Services. I guess, seems like you guys did a lot of great things, but just in general, reflecting, how do you think local public health could have been a little bit more helpful with, whether it's connecting people to vaccines or just, the outreach and the education?
Sure. So from my perspective, we have a public health department here within the Millex band of Ojibwe. And so public health worked hand in hand with our health services. And so from internally, they had a great working relationship and they handled things together as a team. Now, when you start looking outside of the Millex band, sometimes there was maybe some lapses in information sharing, or like, hey, how are you guys doing this? This is how we're doing this. But for the most part, especially in the beginning of the pandemic, it was pretty collaborative. From what I seen and from what I heard from the director at that time, she was having a good working relationship with our local public health and schools, and it was just kind of massaging through those things that were unknown at the time. And as we had advanced through the pandemic, information sharing was still there as far as like, hey, this is what's working for us. How are you guys doing certain things? And so from my perspective, and the information that I was given, the relationship pretty well. I think as things evolved and more information was coming out, and perhaps at times that guidelines changed in the CDC, and there was quarantine guidelines at MDH. Sometimes the local public health and the schools, like let's say in the county, had different quarantine times and things like that. And so that became to be a little bit of a confusion, but for the most part, and I would really refer to Jenna on this because she was the one taking the calls when those confusing times happened and had to kind of to tease through it and figure it out. But from my perspective, in my role, the relationships worked well. But I would definitely get her input on that because she was more boots on the ground.
Yeah, I think we've heard, there were some confusing aspects with CDC guidance, but local public health maybe wasn't quite there yet. Jenna, your thoughts on just how local health, played a role in the messaging and helping out residents?
Yeah, right out of the gates, we partnered on a lot of projects together with our public health as far as like mass COVID testing, antibody testing. We did a partnership or two with Mayo throughout it all too. And then once vaccines started, it was nice to have that collaborative, because as information kept changing, there was always a touch point too. So we were able to collaborate, and we were able to meet with the schools and meet with getting communications out to the community. I think it helped too when our health services endorsed something and public health endorsed something. It let the community know that we were very united in our messaging. And then, that also builds trust when they're hearing some strong messaging come out from groups of people that they're familiar with and have worked with. And so.
For sure. Another question here from Carol Anderson. What do you tell people who said they are not getting the vaccine because they will get COVID, or I know 3 people who got the vaccine and were dead in 3 weeks? AJ, I mean, is this something you might have heard in your area? Like, well, I know so-and-so who got the vaccine and they died. So what's the point? I mean, how do you just kind of even navigate those kind of conversations as a healthcare professional?
Honestly, I try to be honest. I try to be honest with my own experience. I try to be honest with the experience of others that I know. I try to point them to information that is accurate and trustworthy. And, you know, what we deem trustworthy is different for every person, but national, you know, use databases or the CDC or things that I believe that no one can really argue the validity of. But up here, I mean, it is very hard to convince some people that a source is trusted. So it's just really, it comes down to their own belief. Within our school, we've had vaccine clinics, and those can be controversial. We've had parents protesting. We've had, for the lack of better terms, we didn't have very high participation in those clinics because of that. And so it's really just about, again, one by one, day by day, trying to increase our vaccination rate and trying to claw back, you know, that misinformation that early on dominated the conversation. And so again, our main target is doing that in primary care visits as they, you know, visit our clinic, and as they see the doctors they do trust and have trusted for years, if they're encouraging it, you know, maybe we can claw back one by one and continue to try to override that disinformation campaign that I think was definitely present early on during the pandemic.
Yeah. Dr. O'Hara, would you just want to weigh in with your expertise on that question?
I think that really covers really quite well what some of those issues are and what the needs are in this space. It's very difficult to overcome that feeling of personal experience, and this is where unfortunately, when you hear about the 3 people who got the vaccine and then I'll say got COVID because that's more common, it doesn't tell you about the 30 people who didn't or who had mild disease that they didn't feel the need to share the story about.
Yeah, for sure. Well, we're getting kind of close to the end here. I love to do just kind of a wrap of just a takeaway from everybody. Where do you think we go from here? You know, what are the next steps in your perspective? So Dr. O'Hara, I'd like to start with you.
I think that it's important to continue to keep vaccination rates increasing in these communities and work on improving that vaccine acceptance more for this next phase as we move into the endemic, to make sure that we're in a place where we can keep this at a background level and not go through what we've seen in the past 2 years again. And that's going to take continued education and working with communities like this group is doing.
That's great. AJ?
I think for us, it's about being prepared, especially I can be the one speaking from an inpatient setting, for being prepared for the next wave and what may come. I think for us, it's, again, one more vaccinated is one less we may see walk through our ER doors, you know, in coming months or in the coming fall. And I think as we move forward, it's about providing the community as much information from a trusted source that we can. Our hospital is well trusted in the community, where, you know, the majority of, if not nearly all, people are seeking care. And I think it's important we continue to share, you know, trusted information in terms of promoting vaccination, and even if day by day, if we get one more, we'll continue to get that rate, you know, higher and higher, closer to the state average that we are far below at the moment.
Great. Brenda?
Yeah, I hope after all this that our clients and our family and their providers really respect the efforts we've made to provide services in as safe a manner as possible. It's been challenging to be graceful and respect choice and to respect people's opinions. We do all have to kind of remind each other to be that, to be thoughtful of that, but we will continue to encourage our staff and clients to be vaccinated. Again, we have a good rate, but we need to be prepared for the next round.
Yep. Nicole?
Well, I think we keep pushing forward. We keep getting out into the community, sharing information, sharing factual information, providing access. And, you know, do the planning on the front end for what's going to be coming this coming fall. You know, we know it's going to happen, and so be prepared. Like I said, we've already kind of laid that roadmap out, and although I don't want to go down that path again, we all know it's likely going to happen. So be as prepared as possible and provide as much information as possible and be there for the community.
Great. And Jenna, just lasting thoughts on, you know, where do we go from here?
Sure. Over the last 2 years, we've learned a lot. And I think there's definitely highlights of how to get messaging out to people, how to get truthful messaging out to people and build some trust within the communities. And so I think our team will just keep focusing on that and doing what we've done best throughout the last 2 years and continue to pivot to where the need is and where the community needs our support.
Great. Well, I want to thank everyone on this panel, Jenna Kuduk, Commissioner Nicole Anderson, Brenda Geldert, AJ Humes, and of course, Dr. John Ojoro from the Mayo Clinic for joining. I thought this was a great discussion, obviously, you know, very much needed. And as Dr. Ojoro said, we need to be prepared for the next round that's coming, but I think we're really well suited with where we're at here at Minnesota. I do want to remind people that a recording of this webinar will be available on the Center for Rural Policy and Development's YouTube page shortly. And again, thank you everyone for joining us. Hope you have a good rest of your afternoon. Goodbye.
Thank you.
Thank you.